Thank you very much. Thanks a lot for the invitation to present our research results today. I'm very excited to be here. This is such an important topic, not just for Serbia, but for the whole region. So today I will be talking about our study on modernizing the health systems in the Balkans, uneven progress in new institutions that already highlights a little bit of the conclusions of the report. And obviously we focus a lot on Serbia as a special case study. I'm a senior editor at the Economist intelligence unit covering healthcare in particular. I've been at the EIU for 4.5 years, and this is not the first time we are looking at a deep dive into a particular country, but Serbia in particular has been very exciting, so I'm really excited to present this result with you. So in terms of how my presentation will be structured, first I will introduce the study and the background, and then I will talk about the modernization of health systems in the Balkan region as a whole, and then our special case study on the Serbian health system, the need for reliable decision-making compass, and then I will conclude. So in terms of this study, so it's a Balkan report. It's focusing on the whole region. It's about modernizing health systems in the Balkans, and it was commissioned by Novartis, but it was conducted editorially independent, and as you know, with the Economist group, we are an independent research and media organization, so we retain editorial control. It's published by the Economist intelligence unit. It will be published next month, and at the end of this presentation, I will highlight where you can find the report. And how we conducted this study. So we basically conducted desk research. We have an EIU healthcare division with specialists on health economics and market intelligence and generally healthcare information specialists. So this is really the kind of thing these days we're focusing a lot on healthcare within the Economist group. We conducted in-depth interviews with policymakers, healthcare experts, and economists that informed the study. Overall, we examined the reimbursement landscape. We looked at health technology assessment and the various ways how countries in the region are assessing the value of healthcare investments. The 10 Balkan countries we looked at are listed here, including Serbia, of course, and also other countries in the region, such as Albania, Bosnia-Herzegovina, and Bulgaria, and so on, and Slovenia, of course. The country case study focusing on Serbia will be published as well in next month, and there's also an infographic which highlights the results. So look out for that, for those results. Obviously now I will talk about the key findings of the study, but the actual reports and the case study will be published next month. So let's start by looking at our study in terms of the whole Balkan region. What are the key findings of our study so far? So there's, as you know, with the Balkan regions, the healthcare systems still have very much, were based on this cradle-to-grave health system, but it's not longer viable. The healthcare spending is very much scrutinized as, austerity measures have hit the region. So, the countries have been unable to meet the healthcare needs of the population. Many local health systems are excessively decentralized. After Yugoslavia broke apart, there were movements to decentralize the region, obviously, and the excessive sense of decentralization in the region has complicated the process of modernization of the healthcare system. Universal health insurance is very patchy within the region. Out-of-pocket payments are rising and are very high compared to, for example, Western Europe. Comprehensive and consistent systems for health technology assessment, so actually evaluating healthcare investments and cost effectiveness analyses and these kind of things of new drugs and new medical devices are non-existent in most parts of the region, or underdeveloped in countries such as Croatia and Slovenia. They are actually developing these kind of systems, but they are still underdeveloped. Austerity measures, as I mentioned, have reduced spending, particularly on pharmaceuticals. There's a lot of, looking for savings within the system across the region, especially in the area of drugs. The Balkan healthcare systems in general, they need to improve their system for negotiating prices. Our study really showed that many of the countries struggle to have a systematic approach for negotiating prices for medical devices and medicines. So those are the key findings of the main report, but given that we are here in Belgrade, let's focus on Serbia, the need for a reliable decision-making compass. That's the subtitle, and it really sums up the key finding of the case study. So what did we conclude in terms of what happens in Serbia and what is happening in Serbia? So Serbia is really represents, to some extent, is symbolic of the whole region. It's very much facing similar challenges in terms of a very decentralized and fragmented healthcare system. The levels of out-of-pocket payments and corruption are high within the healthcare system, and this is particularly the case in Serbia and other countries in the region as well, but Serbia in particular. The country lacks a transparent and comprehensive system for assessing value of its healthcare investments that applies to medical devices, drugs, and generally all health technology. And actually coming up with a way to determine the price of health technology is very lacking transparency in Serbia, and is not very systematic. So these issues have consequences, obviously. As I will show later in this presentation, there is a mismatch between health spending, which is actually in terms of GDP quite high in Serbia, but the health outcomes are very weak. And part of that is the result of weak access to the needed healthcare in Serbia, which is a result of the lack of this kind of systematic approach and the lack of transparency. There's been slow progress in modernizing the healthcare system in general, but this will be increasingly under the spotlight given that Serbia is in negotiations to join the EU, and there have been a couple of developments that are quite exciting in terms of Serbia joining the EU, which could be an impetus for positive change for Serbia and increased pressure to change. Let's look in a little bit more detail about this, what I mentioned earlier, the mismatch between healthcare spending and health outcomes. So Serbia is actually the country with the highest total spending on healthcare as a share of GDP. It's important to highlight this as a share of GDP. So about almost 11% of the whole economy, like the whole size of the economy, is spent on healthcare in Serbia, much higher than other countries in the region, as you can see in this chart. But Serbia is only fifth in terms of total health spending per capita. So actually, every person in the country is not actually spending as much on healthcare as in other countries. Slovenia, for example, has a much higher spending on healthcare per person. But even that spending is not translating into positive health outcomes. So life expectancy, for example, is significantly below the EU average, and also it's below the average for the region. So the WHO region, Southeastern Europe, life expectancy in Serbia is below that as well. The EIU conducted a study in 2014 where we looked at health outcomes compared to health spending. So we looked at things like life expectancy and so on, and compared that on things like disability-adjusted life years, so how many years people are living in poor health. And we compared that to how much the countries are actually spending on healthcare in 166 countries. And there were 6 tiers, that we grouped countries into. Serbia is in the 3rd tier, so it's slightly above average in terms of health outcomes. But in terms of spending, it spends more than is reflected in the outcomes. As you can see in this chart, this is the 3rd tier. These are the countries in the 3rd tier, so with very similar health outcomes in terms of life expectancy and so on. And Serbia is one of the countries highlighted here that has higher healthcare spending than outcomes. So countries, for example, on the left, Sri Lanka, Vietnam, and also Albania from the region, are actually countries where the outcomes are higher than the spending would suggest. For Serbia, it's the other way around. Healthcare spending, the ranking for healthcare spending is higher than the outcomes. So Serbia spends a lot on healthcare, but the outcomes are not really that positive. So that's obviously disappointing. And let's find out, or we try to find out why that is. Why is there this mismatch? So out-of-pocket payments in this country, in Serbia, are very high. So informal payments between patients and doctors is very high. These co-payments are a much larger share of overall spending in Serbia than in many other countries in the region. It's just below 40% in Serbia. This is much higher than other countries in the region. For example, in Croatia, only about 20% of healthcare spending is out of pocket, so people directly paying and not reimbursed by the overall healthcare system. So that reflects these informal payments. It reflects corruption in the system. The 2013 survey highlighted that the health system actually comes second in terms of corruption. So only political parties are perceived as more corrupt than the health system in Serbia. And obviously that is partly reflected in these high out-of-pocket payments. There is a need for reform in the health insurance system. So, for example, if these direct payments for services rendered were actually legalized and formalized in the health insurance system, and if there was a more precise compulsory package that is reimbursed by the health insurance funds, then there could be potentially an improvement in terms of the transparency and less corruption and potentially less need for these out-of-pocket payments. So this is a big issue, the out-of-pocket payments in this country. There is, as a result, this gap between the funding and commitments. Serbia struggles to find ways to fulfill its commitments for healthcare access for the population with the resources that the government has. The National Health Insurance Fund has difficulties actually collecting contributions from employers. This means that pharmacies, providers, and manufacturers are not paid on time, and ultimately this leads to a shortage of necessary drugs in various fields such as Hep C and so on. The European Commission concluded last year in its progress report on Serbia that the poor financial situation of the public health funds puts the sustainability of the healthcare sector in question. So this is a big issue that the National Health Insurance Fund is struggling to collect contributions. One of the key reasons why we have these issues with lack of transparency, with weak or poorer than expected health outcomes, is this lack of a reliable decision-making compass. The health technology assessment is a process that is particularly developed in Western Europe, whereby new technologies such as medical devices and drugs are assessed in terms of their cost effectiveness. And if you look at countries in the Balkan region in general, it's weakly developed. Some countries such as Slovenia and Croatia are making progress, but in Serbia it is very much lagging behind in general. There's no official health technology assessment agency. The National Health Insurance Fund carries out some activities, pharmacoeconomic activities and so on, and the LIMS evaluates the quality, safety and efficiency. There's also an HTA committee within the Ministry of Health, but it does have little technical support. Serbia does not participate in the European Network for Health Technology Assessment, unlike, for example, Croatia and Slovenia. There's a reference pricing system, which means that the maximum prices are based on the lowest prices in 3 reference countries, Slovenia, Croatia, and Italy. There are also price volume agreements between manufacturers and wholesalers, and from last month, negotiations have started on formalizing the introduction of managed entry agreements between the pharma sector and the government. But obviously, without a reliable compass on decision making, without having a proper reimbursement structure in place that is transparent, these developments, and as we will hear later on in other presentations, might be undermined. If there is no transparency, if there is a weak decision-making process, then pricing is very difficult and it's very difficult to assess the value of new health technology in this country. So overall, the decision-making process for reimbursement of pharmaceuticals and medical devices is very patchy in this country. There's lack of clarity to what extent the government has actually implemented a new rule book. In 2012, there was a rule book on cost effectiveness and budget impact analysis for new drugs was adopted, but it's very unclear how the government is actually adhering to it. So it is there on paper, but that doesn't necessarily mean that the government is doing anything about it. There's a clear lack of transparency, not just in terms of this rule book, but also in terms of things like the exchange rate used in pricing negotiations. So generally, the theme of lack of transparency really shines through in most of the issues we looked at. As a result of all this, fewer drugs are placed on the reimbursement list, as we heard in the introduction as well from the Ministry of Health, that there is fewer drugs are placed on the reimbursement list. For example, between 2007 and 2010, 12 of 228 new medicines were registered in the EU. So 228 new medicines were registered in the EU, but only 12 of those were approved for reimbursement in Serbia. But 148 were put on that reimbursement list in Slovenia, 83 in Bulgaria, and 62 in Croatia. So other countries in the region where the system is slightly more, going in the direction of actually assessing cost effectiveness, there's more access to these new drugs. Since 2010, the EU has registered 139 new medicines. Bulgaria put 44 on the reimbursement list, Croatia 27. This is just by way of comparison, but Serbia only 1. So there's clearly a sign that the country is struggling in terms of assessing and reimbursing new drugs and medical devices as well. One of the developments we have seen in Serbia, but not just in Serbia in general, where the global financial crisis has a bit of a lagged effect on unemployment and so on, and higher unemployment means less funding for the National Health Insurance Fund, which then means there has to be some kind of savings within the system. And one of the results of this is that the government has tried to cut pharmaceutical expenditure. The National Health Insurance Fund introduced a new rule for pharmaceutical companies from 2011-12 to require them to give a 10% rebate on all prescription medicines. There's also a new regulation called Article 29 that was introduced in 2014 that aims to reduce the price of off-patent originators by up to 49% compared to the current list prices. And this is supposed to save about 5 billion dinars in the drug budgets. But the big question is whether these savings will be reinvested in actually modernizing the healthcare system, or whether they are just meant to reduce the budget deficit. So that's a big question that will have to be answered in the future. So what's the impetus for improvement? Are there any signs that there is improvement in Serbia? There have been some limited efforts to improve the efficiency in the system. There have been capitation system has been introduced in primary care, and we have the launch of the payment mechanisms based on diagnosis-related groups. In Western Europe, we have a lot of these developments in terms of actually grouping these different groups together, and this improves patient data and so on. So in the end, this could be good as a first step to improve the process for actually assessing health outcomes in this country and improving access. The second thing is the World Bank's Serbia Health Project. It's the second Serbia Health Project. It was approved in 2014 and aims to support the quality, efficiency, and transparency of the health system. So exactly the kind of things that are problematic here for both primary and hospital care. So this is about strengthening the HTA, which actually doesn't really exist in this country, but making, helping Serbia to get in the direction of actually developing an HTA, and also management of selected priority non-communicable diseases. The government has also started to pilot centralized procurement for drugs, but the bidding process for this takes only place once a year. So the question is how effective this will actually be. There's a greater focus on monitoring health outcomes. It's such an important topic, especially in Western Europe. Some countries are making big progress there. Portugal, for example, to actually collect patient data, which then helps to assess whether therapies are successful, and this then informs the cost effectiveness decisions that the system makes. And there's some more focus here in this country on actually monitoring these health outcomes. And then there's also the EU negotiations, the EU access negotiations. This is really an important topic because Serbia wants to join the EU by 2020. And healthcare is one of the elements of actually joining, the EU. Chapter 28 is one of the many chapters that Serbia has to go through to become a member of the EU, and this could create impetus and then more of an incentive for Serbia to do something about the lack of, modern healthcare system in this country. The government joined the EU's health program for 2014 to 2020, so there is a commitment, at least, from the government to do something about these issues, to bring the healthcare system up to standard with the EU. But the European Commission is still very skeptical. There have been, like last year in the latest progress report, there will be another one in October, I think, this year. So watch out for that one. But last year they already said that there are still issues with the corruption. As I mentioned earlier, this also is one of the biggest conclusions of our study, which is the lack of transparency and the problem of embedded corruption. And the European Commission has also highlighted that. There's a shortage of medical and administrative staff in primary healthcare, and there's particularly weak access for some groups in the country, such as prisoners and the Roma population. So these are the concerns highlighted by the European Commission. In conclusion, there's, as has been shown in our case study as well, there's really a systematic weakness in this country in the healthcare system. Corruption is an issue, lack of transparency. There's no comprehensive system for assessing health technology in this country, and that's a big issue that affects access to healthcare for the population. These weaknesses are highlighted in the data that I showed earlier in terms of the mismatch of spending. Spending is not that low in this country. It's the highest in terms of the share of GDP in the whole region, but outcomes are not really showing this spending, and they're not really up to the standard that it could be. Serbia continues to prepare for EU membership, and the ability to implement these reforms, to improve transparency in the system, to reduce out-of-pocket payments. These are one of the things that the EU will look at and will be crucial in terms of highlighting whether Serbia is prepared to join the EU or not. So if you want to know more about this study, it will be published next month. It will be on eiuperspectives.economist.com. So we will have the Balkan report, we will have the Serbia case study, we will have an infographic that summarizes the whole research findings, and you can also follow me on Twitter so we get all updates on the study and when it will be released. Thank you very much for your attention. Enjoy the rest of your conference.